see it now.
Yeah. So as Ajay was saying, nowadays I think many have adopted IOL implantation under water, no, in not using visco, but there can be issues. I'll go through some of small clips of videos and let us see if there are issues involved there. Now this, carefully see, there is a break in the cartridge. Can you see there is a break in the cartridge and water is dribbling out. So in these cases, sometime you may have this tight IOL in the cartridge can hit very hard on the other side, and it can even sometimes cause issues like injury in the iris or injury in the or PC rent even, or equatorial injuries all can be there. Now see carefully this one. You see there is a shooting of the IOL, and you can appreciate the posterior capsular stress lines very carefully. See? So this actually may lead to a PC rate and IOL can drop even. This case, luckily nothing happened. Now the loading of the IOL, no, is not proper sometime. Your leading haptic is just pointed like a gun. You have to rotate carefully. A skilled hand actually get away with all this, but sometimes learners, beginners can have problems. So in that cases, you did not to go and put this IOL if you are not sure that you'll be able to put. So beginners actually should do that cases under visco delivery. The IOL after you insert can rotate like that. So this can sometimes cause some injury in the cornea, back of the cornea. But your second instrument, that is your irrigation port, that is on the other hand, should guard. As for example, here, once the IOL was trying to rotate, as because the leading haptic has not gone in the bag, and the second, that is the irrigation port has not supported the IOL very well, and then you can have these rotations happening. And you can stop the irrigation for a while. The rotation will stop. I can just show as the rotation started, the irrigation now, yes, stop the irrigation, the rotation stops. So you can go ahead now with the surgery. So IOL can flip. You can notice here that the irrigation port is little bit away from the IOL. So there is a chance that time that the IOL gets flipped. But you can get away in many cases without any problem, but there can be issues. I will show. You have to guard with the irrigation port. Even if there is a tendency of rotation of the IOL, flip of the IOL, you can guard and guard the cornea also. You can get away. But even then, rotation during this time, no, you see the haptic may be rubbing your cornea. So be careful in these cases. Don't be very much daring. You must put a viscoelastic and protect your cornea well. Here the IOL flip, you can see is quite a bit, almost full. The trailing haptic is yet not unfolded. So there is a chance yet you can do maneuvering. This can come back. You have to be very, very careful that you do not rub cornea. If you feel there is a problem, then you must not go ahead, put a viscoelastic and do. Here you can see the IOL flipped, and even these haptic have unfolded. So when there is engagement of both the haptic gone in some places there, you cannot rotate. You cannot flip back. it is extremely difficult. So it is always recommended that you put viscoelastics well, and then you can well maneuver this, put in the place. Here, sometime IOL implantation, if you sometime you think that this has stuck the in the iris, it has not gone in the bag in the first go. And this haptic, this is hydrophilic lens. So this haptic sometimes touches cornea and can cause problem. So in these types of haptic, no, you have to be very careful putting these IOLs under water. Sometimes your trailing haptic may remain outside. Sometimes difficult because the AC is collapsing. Sometimes the water comes out. Little bit of difficulty can be there. You have to be very sure that leading haptic has gone in the bag. Now see, it was not gone. Now it has gone to the bag. So sometimes confusing. The haptic has remained outside. This happens mostly in wound assisted deliveries, and it is sometimes difficult to put in this trailing haptic. And once your people is becoming smaller, AC maintenance is poorer because of the leaking wound. So many a time you have to struggle quite a bit. So do not wait, put viscoelastics very nicely and then go ahead with the surgery. Too much of struggle will cause a lot of problem there. In this case, as the optic haptic junction has just struck the iris, patient squeezed and the whole pupil became small and the IOL remained vertical. And it is disengaged from the wound. As it has been disengaged, the IOL automatically became flat. But this has caused a line of endothelial injury here, where it was stuck in the vertical position. So this can be dangerous in many patients. So in topical anesthesia, it's also an issue. Like this water delivery is also an issue, and you are taking chances in many patients. So you may have to face such a problem in many cases. IOL stickiness can be bothersome sometimes. These are some of the issues you always face, but this is not a big issue. This you can wait for 30-second, 40-second time and get away with this stickiness. It goes. But here is a case. This is a little bit longer video. I'll shorten it. See, this haptic has stuck on the behind the optic. Behind the optic. I was trying. It was underwater delivery. I was trying to disengage and detach this attachment with two instruments on both the irrigation aspiration port. Used viscoelastic now and tried with two separate instruments of spatula and the Sinski hook and made the IOL vertical and gone in between this junction in the gap between these two to detach this attachment. It is so stubborn that it is not getting detached. It is so difficult. It took about 3 to 5 minutes time. See, you can see it is literally tearing off, as if I am tearing off the IOL. It is not coming out yet. This is a acryol EC IOL that I implanted, and from that experience, I have avoided using this. No doubt this has happened because of increased stickiness they have put in the back of the IOL so that the PCO rates are less. But this has caused this a problem because IOL, the cartridge loading sometimes can cause, these are loaded by the assistants most of the time. So you may land up such a problem. I think you can appreciate such a struggle that I had to do, and it is not yet opened yet. No, this is the time. This is last part. Now it has released. So upside down the lens was been made, and then it has gone. So difficult sometimes. So underwater delivery can be even bothersome in these cases. So the main thing is putting the cartridge inside. It is better to put be in the inside and guard the eye well with the irrigating port, and then put in the eye well. In this type of haptic, also see the leading haptic has gone well in the inside, and guard the eye well before it unfolds, and then you can tuck it into the bag. So thank you.
Thank you.